Asthma. Etiology. Asthma can be categorized by symptoms, triggers, age of onset, severity, and treatment response. The types of asthma include allergic asthma, which is triggered by allergies, non allergic asthma, which is triggered by irritants in the air, cough variant asthma, which is distinguished by a dry cough, nocturnal asthma, which is worse at night, seasonal asthma, which most likely occurs in response to an allergen such as pollen, exercise-induced asthma, which is triggered by exercise and is also called exercise-induced bronchospasms, occupational asthma, which happens primarily to people who work around irritating substances, and asthma COPD overlap syndrome, which happens when you have both asthma and COPD. The exact cause of asthma is unknown, however, there are some early life risk factors such as low birth weight, early exposure to tobacco smoke, and viral and respiratory infections that can increase the risk of asthma. Other things such as environmental factors like indoor and outdoor pollution, house dust mites, mold, and occupational exposure to chemicals, fumes, or dust can contribute. A genetic predisposition reaction towards pollen, fungi, or animal-derived proteins can also contribute to asthma. Finally, research suggests a link between excessive weight gain in young children and the risk of developing asthma. Demographics. According to the American Lung Association, in the United States, asthma is more common in young males at 8.3% compared to young females at 6.7%. However, in adults, it is more common for females to be affected at 9.8% compared to adult males at 5.5%. The same study presented data on how different races/ethnicities were affected, with American Indians/Alaska Natives being affected at 12% and Asian Americans only being affected at 4%, as well as those with lower income are more likely to have asthma. Anatomy. Asthma affects the airways in the lungs, which include the trachea, main bronchi, larynx, pharynx, and mouth. Asthma occurs when the airways become inflamed or overreact to stimuli, causing the airway muscles to tighten, making it harder to breathe. Physiology and symptoms. Asthma is a chronic inflammatory condition of the respiratory tubes that causes the muscles in the airways to tighten, the inner lining to swell, and membrane to secrete more mucus. This mucus can form plugs that block the airway passages. The rush of air through narrowed airway passages produces wheezing. Symptoms include chest tightness, labored breathing, coughing, wheezing, and shortness of breath. Diagnosis and treatment. Doctors diagnose asthma by considering a patient's medical history, symptoms, and family history, as well as performing a physical exam, listening to the lungs, and ordering lung function tests. There are many treatments to ease symptoms of asthma, such as oral medication, injections, inhalers. Other things that can help with asthma are allergy shots, using an air conditioner or air purifier, regular exercise, or breathing exercises. Treatment plans depend on age, symptoms, and response to treatment.